COVID-19 is projected to be the third leading cause of death in Santa Clara County this year, behind only cancer and heart disease. The data released by health officials today will reflect 632 cumulative deaths reported to date. We will hear from our county leadership today. We'll hear from James Williams, our county counsel, Dr. Sarah Cody, our public health officer, Dr. Ahmad Kamal, our surge capacity director for the Emergency Operations Center, and we'll hear from Dr. Heng Yung from VMC. And we'll also hear from Supervisor Cindy Chavez today. So up first is James Williams. James?
Thank you, Betty. Good morning, everyone. James Williams, County Counsel for the County of Santa Clara. We are here with a really important and critical message as we head into Christmas and New Year's and this holiday time when we all want to spend time with our families and our friends. We now have 632 deaths from COVID-19 here in Santa Clara County. 631 people right now with COVID-19 in our hospitals, and nearly 60,000 cases of COVID-19 have been recorded in Santa Clara County. When we came to talk with all of you before Thanksgiving, we were extremely concerned about a surge of cases from travel, from gatherings, and that surge occurred. And we are seeing the results of that today in the rise in hospitalizations, the rise in deaths, the limited capacity available, the number of cases. And what concerns us so much heading into these otherwise very joyous celebratory times, these next few days, is that we are way, way up here in terms of cases and hospitalizations. And so if we see another surge coming out of Christmas and New Year's and the holidays that looks anything like what we have experienced coming out of Thanksgiving, we are going to be in an extraordinary crisis here in Santa Clara County. And we know that no one wants that to happen. We're concerned to hear about how much travel is occurring. We know it has been an extraordinarily difficult year for our entire community, for all of our families. But we are here to urge everyone to strictly adhere to all of the public health guidelines, all of the public health orders, to cancel your travel plans. Do not gather. Do not gather. So much of the spread of COVID-19 is asymptomatic. That means you don't know you have it, and you may inadvertently spread it to those you love and care about, or who may spread it to others in a chain of transmission. Do not gather. We know how difficult that is to ask. We know how difficult that is to mandate, but that is exactly, unfortunately, the reality of where we are right now, right here in this moment. With vaccinations starting, we're going to be in a much better place in the months to come. But we want to be there together, all of us alive and healthy and well, in our families, in our communities, our friends. And in order to get there together, it is imperative that everyone in our community, every single person, come together now and do what we know we need to do by avoiding gatherings, always wearing face coverings, and not traveling. And we have put in place very, very critical safety rules to help make sure that we can all be here together to celebrate holidays and important and special events in the future, such as the county's mandatory 10-day quarantine for those who travel. And if anyone is traveling, and if anyone is doing these high-risk activities right now, those rules are absolutely imperative, absolutely critical at this moment in time. We will be doing everything we can at the Emergency Operations Center with our enforcement and compliance teams, with our messaging, being proactive, but we can only do one piece of this puzzle. It's an important one, but it's only one piece. Every single one of you is another piece of the puzzle, and only through your own decisions and choices collectively as a community can we be safe, healthy, and have the joyous holiday season that we all want to have, and be able to celebrate how much we have been able to do together in this extraordinarily difficult and unprecedented 2020 year. I'm now going to turn it over to Dr. Sarah Cody, our health officer.
Thank you, James, and good afternoon, everyone. As you've heard from James, we are facing a very, very difficult and very dangerous time in our county, in our region, and in our state. All of our numbers are going the wrong direction, and our reality is rather grim at the moment. I just wanted to share with you in pictures so that all of you can see and understand where we are together. I'm going to tell you a little bit about what I think this means and what we are all urging every single person in our community to do. So this is our epidemic curve here on the far left. And as you can see, the surge that we're in right now is so dramatic, it almost appears as though we hadn't had 2 prior surges. As James mentioned, we had a significant surge around Thanksgiving in spite of imploring, begging our community to please not travel and to please not gather. We still, unfortunately, had a surge in Thanksgiving, as you can see there. It has taken all of our collective might to try to calm things down. But if we have a surge on top of a surge, we will definitely break. We cannot afford that. We cannot afford another surge on a surge. And let me tell you why. This here shows deaths from COVID by week in our county. So this is by week and this is by day. But what you can see is a big bolus of deaths. Our friends and our family are dying of COVID. We are on track to have COVID be the 3rd leading cause of death of all causes in our county. The death numbers always lag the cases and always lag the hospitalizations. And unfortunately, what we know from these numbers is that our deaths are going to continue to rise into the new year. But we must, all of us, do everything we can right now to prevent as many of those deaths as we can, to not have more deaths than we already expect that we will. So this is the unfortunate backdrop as we close one of the most difficult years that we can even imagine in 2020. This is the time when we want to come together, we need to come together, but we cannot come together in person. We cannot come together in person. It's just not safe this year. One of the enormous, enormous challenges of COVID is that it's silent. You can't see it. Your loved one doesn't look dangerous. And you can have chains of silence spread that you don't see that end in someone being hospitalized or end in someone dying. But if we each do our part and we stay just within our household bubble, we can prevent people from dying, and that is what we must do. That is the holiday gift that we must give each other. So as Dr. Kamal will describe, our hospitals are so stretched so stretched right now that they cannot handle a large bolus of more patients. We can't handle more than we're already on track to have. And that's why we have to just put those brakes on as much as we can. So I understand that this is a very hard message to hear. It is not the message that we want to be delivering on the eve of holidays where our tradition is to come together. And the message is even harder to do than to hear. But we cannot emphasize enough that this is a matter of life and death. So please do not gather. Celebrate with just those in your household. If you have plans to travel, go home and cancel them. Cancel your travel plans. Celebrate over the phone, over social media, over Zoom. Cook a meal in your home and enjoy it with just the people in your home. It can save a life, it will save a life, and it's very important to do. So I'm now going to pass this along to Dr. Kamal.
Thank you. As of today, we are down to 35 ICU beds in our entire county. In addition, 8 out of 10 hospitals have 5 or fewer ICU beds, and 3 of these hospitals have fewer than 10 beds of any type remaining. As a result, as of yesterday, there were 68 patients in the emergency room waiting for a hospital bed who did not have one. This is where we are today. This is where we have come as a result of the surge we have seen in Thanksgiving, with gathering and with traveling. As you can see on that graph, our number of hospitalizations continues to rise. That red line is the maximum. We are very close to that line. On the other side of that line are things that would have been unthinkable a few months ago. We are talking about people in gurneys without a bed to go to. We are talking about people not getting hospital care. We are talking about rationing what scarce resources our exhausted health system has left to those who will benefit the most. We are talking about people dying who should not have died. And when hospitals are at that point where they are rationing care, where they are having to turn away people who desperately need their services, it's no longer just about COVID. It's about everybody. It's about people in a car accident. It's about people with a heart attack. This will affect all of us. Every single family, every single individual in Santa Clara County will bear the brunt of our decisions over the next several days. Our hospitals are at a brink, and they are just on the verge of being pushed over. And the only way we can keep them from that future, the only way that we can give the gift of life to ourselves and our loved ones, is to pick up your phones right now, cancel any gathering that you were anticipating with anyone who does not live with you. Cancel any travel plans that you have, even if it's in a car a few hundred miles away. Cancel it right now. I cannot emphasize enough how our collective actions today and tomorrow and the next day are a matter of life and death. People spread COVID in gatherings, as we've seen in Thanksgiving. People spread COVID without knowing they're sick. And people spread COVID even if they're loved ones, even if they're your cousin, even if they're your uncles, even if they're your neighbors. This chain of transmission ends in death, and it ends in our hospitals that are gasping for air, running out of oxygen. Please, I implore you all, pick up your phones, cancel your gatherings, cancel your travel. Do it for yourselves, do it for your loved ones, so we can all see 2021 together. Thank you. And I'd like to introduce Dr. Duong from Valley Medical Center.
Hi, everyone. I'm Dr. Heng Duong. I'm one of the pulmonary critical care physicians at Valley Medical Center. I'm here to just give a little brief sort of flavor of the front line of intensive care at the hospital. And I guess if there's one word that can summarize the current emotional temperature of workers in the hospital and the intensive care unit, it's exhaustion. Everyone is just exhausted. They're exhausted for a variety of reasons. They're exhausted physically, just because of the very high medical complexity and acuity of all the patients that we're seeing. They're exhausted because of the sheer number of patients that we're seeing, which has really spiked in recent weeks. Everyone has had to really dig deep and work very, very long hours in order to give our very best medical care for these patients. Aside from the physical aspect, everyone is emotionally exhausted. They're emotionally exhausted because it's hard to see patients who are suffering and dying in the ICU and in the hospital. And it's emotionally very heartbreaking to see patients who are sick and who are dying away from their loved ones, and oftentimes dying alone. And I guess the last piece of it is that they're emotionally exhausted just because, like everybody else in society during this pandemic, we're affected just like everyone else in terms of being tired from being away from our families, missing them, and oftentimes, as healthcare workers, oftentimes quarantining away from our own families. So it's physically and emotionally exhausting for everybody involved. So this holiday season, I really urge everyone who's planning on getting together to just stay away. Remember that COVID can spread even in asymptomatic individuals. You or your loved one might feel just fine and still be able to transmit the disease to somebody else. Stay away so that you don't get sick or get your loved one sick, and so that they don't end up in the hospital. And that would be the best situation of all. Stay away from everyone, so that when in the unfortunate case that someone does end up in our care, that we have enough left in the tank to be able to give them the very best care. And so I really urge everyone to stay away this holiday season, so that hopefully we can all be together next holiday season. Thank you.
My name is Cindy Chavez. I'm president of the Board of Supervisors, and I really just want to thank Drs. Kamal, Duong, and Cody, and President Williams for being with us today. Let me just start by saying I know this is a message you're all very tired of hearing, but I want you to think about this in a slightly different way. In our community, in our society, we wear seatbelts. Why do we wear seatbelts? We wear seatbelts to protect ourselves and to protect anybody else who's in a car if we get in an accident, so we don't fly into somebody that we love and harm them. We stop at stop signs and stoplights. Why do we do that? We do that so that we make sure there's no collisions. The reason we're asking people to wear your mask and stay socially distanced is we're trying to make sure that we're keeping everybody in our own households and other households safe. I want to say a very sincere thank you to every one of you who's been sheltering in place and doing your best to be socially distanced. And I miss my mom, I miss my sister, I miss my brother, and I haven't seen them really for almost a year now, and I won't get to see them this holiday. But what my hope is that by missing this holiday, I won't miss many, many, many more holidays with my family and the people that I love. Remember that we're a community and we're a society. Wear your mask the way you'd wear your seatbelt. Stay socially distanced the way you wouldn't text while you're driving. And you certainly don't do that when you have somebody in the car that you love. So let's treat the entire community With the same love and respect we want others to treat our family members. And thank you very much for being here.
Before we move into our question and answer portion, I just want to remind everyone that the county will be providing statements in Spanish, Chinese, and Vietnamese after the press event. Our PIO representatives will also be available on hand for one-on-one interviews and additional conversations in also English, Spanish, Vietnamese, Chinese. So we'll go ahead and go to questions now. Just raise your hand. I'll call on you to make sure that everyone gets their questions asked. Chris.
So the question is, will this surge be different? Will we be able to prevent this surge, given that we were not able to prevent a Thanksgiving surge? What I will say is that it is often difficult to see what we have prevented. I hope that we didn't prevent a surge entirely at Thanksgiving, but I think that we may have prevented a larger surge. Our huge, huge, huge concern at this moment is that our case levels are so high that any surge added on at Christmas will be magnified tremendously and will translate to people needing a hospital bed when there are so few hospital beds available, and will ultimately translate to people dying, preventable deaths from COVID. But what we are all wanting to get across in any way that we can is that COVID is preventable. We do have the tools to prevent it. See? Even the horn believes. We do have the tools to prevent COVID. They're difficult to practice because we've been at it for quite a long time. But we've done it before and we can still do it. We know how it's spread. It is spread through the air. So don't get yourself in a place where you're going to be sharing a lot of airspace with people outside of those in your home. And if you are outside your home, as we are now, we are outside, we are wearing face coverings, and we are distant. I'll ask James Williams to make some additional comments, but what I would say is that we must remember COVID is a silent killer. There'll be silent chains of transmission until someone is severely ill and requires hospitalization and dies. So to say that you're having a large gathering and you know it's safe and you know it won't harm anyone is false. A large gathering, particularly in the setting with extremely high levels of community transmission, will translate to illness and death if people hold large gatherings. Probability just dictates that that will be the case. And so I urge anyone who is considering gathering to stop, take a deep breath, think, and don't do it. Because we want everyone to be here next year so that we can gather. This year is already a crazy year. We are not doing anything this year the way we have done it in previous years. We can't. We're in the middle of a pandemic, right? And so this is not the time to just say, oh, I'm tired. We can't. We can't afford it. This is what will happen.
So what I'll say about Cavalry Church, it's beyond disappointing. Frankly, the situation there is shameful. We have court orders, and we are a society of laws and rule of law. And what they are doing is not just disobeying lawful public health orders, but on top of that, preliminary injunction, issued by a court of law. We will continue to pursue enforcement against their law-breaking activities, and we will continue to be active in doing so. There are real consequences. There are very real consequences, and they will continue to face those consequences. And by choosing to do what they are doing, as Dr. Cody mentioned, they are putting everyone's lives in this community at risk, and that's just shameful.
Thank you for the question. So we have seen some softening of the rate of rise of our cases, and that is good news. So if you look there, whoops, I'll just step over and point to it, then I'll come back to the mic. So we are beginning to see the early signs of some softening, and that the rate of rise through November and the first part of December was so extraordinary, faster than anything we've ever seen. And the rate of rise has slowed. And you can see that in the orange line, that it's no longer going like this, it started to go like this. I think that does reflect the actions that we've taken and our community hearing the message and changing their behavior. So that's fantastic. What we're saying here today is, though, that if we're having an average of 1,200 new cases a day, those levels are very, very high. So if we don't really stick the dismount here at Christmas, we are going to go way up, right? Because if you build after you're already very high, it's quite different than, say, where we were in the early summer when our rates were very low. So that's the key.
Fair to say then that the shutdown arguably is keeping you from going past this threshold that you laid out for hitting the capacity line?
Well, one of the many facets of the pandemic that is so challenging is that there's no single prevention measure that is 100%. So we have to do all of these layers of prevention and put them all together in order to best protect our community and our families. And so it's reducing mobility, wearing masks, being outside, keeping distance, being in small groups, limiting the duration of contact, et cetera, et cetera. We do have light at the end of the tunnel because now we have a vaccine to add to that. But as everyone knows, the vaccine just arrived. It's just beginning to go into people's arms. And so all of those other layers of prevention, we've got to stay on it, right? Until we have enough of our community vaccinated, which is going to take, many months.
I was going to ask James something, but first, since you said that, feeling like maybe there might be a false sense of security or something from all the vaccine news that people are hearing right now? What do you want to say?
So our message about the vaccine is the vaccine gives us hope. The vaccine, I hope, will help us know that we can do this. We can keep all these other difficult measures in place because we know that it won't go on forever. But we must continue to practice all of these prevention measures because the vaccine, we don't have population protection. It's going to take some months to get population protection. And in the meantime, we cannot ease up on masking, distancing, hand washing, not gathering, not traveling.
You were talking about the church gatherings and kind of focusing on large gatherings. We're starting to see like salons and people like that who do more one-on-one kind of things, being able to justify what they're doing because they're able to take, they feel are those safety precautions necessary from that. And also too, they acknowledge that a lot of the salons are doing backdoor business, so a lot of that is going on now. What would be your message also to them in terms of enforcement, as well as what about all the backdoor kind of services that are going on?
So the question was about backdoor services and other businesses that may be performing, salons and others that might still have activities. A couple important points. First of all, if people see any of that occurring, go to scccovidconcerns.org, report the violation. We follow up on all of those violations. We have a compliance team. We have an enforcement team. And we do take an education first approach, but we do follow it up with fines and other actions where necessary. So if people see something that's not right, it's a safety issue. It is a safety issue. These rules are in place precisely because we're talking about people's lives, we're talking about serious illness, we're talking about death. And so if you see a concern, go to scccovidconcerns.org, and we have a whole team that follows up on those. And to those businesses and other entities, my message to them is very simple. Now is not the time. We know it's been an extraordinarily difficult year. The federal government is hopefully going to step up and provide some financial relief. We know that that's a huge issue for businesses, huge. But now is not the time. 632 deaths, 631 people in our hospital right now, nearly 60,000 cases. This is not the time. We have to hold on together as a community, and it is not optional. It is required to follow these very basic, critical mandates to keep us safe.
Just a quick follow-up. We were hearing about how much the churches, and Calvary churches specifically, were being fined. Do salons and smaller businesses like that face the same level of fines and the same kind of enforcement?
Yes, it depends on the nature of the violation. But yes, we, depending on what's occurring, and fines are issued accordingly if necessary. But it's really specific to the facts of each circumstance, what specific issues there may be. The issue with Calvary Church is a little different in that it's been ongoing non-compliance, so that's obviously added up quite significantly.
Okay, last question. Chris? I think there's a sense of the community that if you're following the rules, you're not necessarily rewarded, you're still being searched, because the people who are not following the rules are not being punished. And I know that you have an enforcement team, but that's very limited. And everybody has a neighbor who's still having parties. You go to the airport, you're an SFO, you're in Tampa Bay, people have. So you can only beg so much, but this might feel like you're preaching to the choir. How do you change that? How do you get people to listen who haven't been traditionally listening?
The question is, how do we get people to listen, and how do we get people to change their behavior? Right. Our partnership is you. Our partnership is you in the media, and particularly the media that serve communities that may not be understanding the urgency of the message. And we do need your partnership. The media, leaders in the community, elected officials. This is we need everyone. I think there's both the hearing the message and understanding what you need to do, and then being able to actually do it. and sometimes those are pretty different. So I will say we do understand that there are many people living in our community who live in conditions where they have enormous difficulty isolating even if they're sick because they live in crowded homes. We have people who are frontline workers taking care of all of us, and they must use public transportation. So that is the truth. However, there are others who can make changes, and we need them to make changes because it protects everyone. This is challenging because it's a virus that we can't see. And so it's not like other actions where you do something and then you immediately say, oh, that didn't work out so well, I won't do that again. Because you take an action and you may not see that your action actually sparked a chain of transmission that ended up in someone else dying, right? We can't see it. So it's about continual education, sometimes one-on-one, sometimes in a forum like this. But we really do need everyone's partnership in trying to reach those that have been hardest to reach. Thank you. Of course.
Yeah, what are we doing? Yeah, so so two things I want to say. First, I want to say we have to really thank the people who are going the extra mile to wear their masks, stay socially distanced, and who are staying at home. The sacrifice that so many people are making, we need to acknowledge it. We also need to acknowledge the frustration of seeing people just not, violating and it's not violating rules, it's risking other people's health. And that's really the point we need to make. But the county's doing a couple things that I just want to acknowledge. One is that we have programs where we're reaching out door to door. We have literally 100 people going door to door to educate people about how businesses can be safer, how homes can be safer. We're signing people up on doors to get tested. We're testing people on doors. We just kicked off a program this week called our Ambassadors Program, where we're asking the public to take responsibility for their neighborhoods, their Lions Club, their Rotary, to really educate people. So in addition to making sure that we're here saying, we need your help, and thank you to those who are already helping, we're actually asking our community to stand up and take responsibility not just for their own family, but their neighborhoods, their service clubs, and their businesses. Because we recognize that this is going to take a lot of voices, a lot of shoulders, and a lot of persuasion to make sure we can keep people moving for another 6 months. That's really the goal. As a community leader, I can't imagine willfully putting people at risk. And what I would say to the leaders, not just of that church, but across the country, is that when people follow you, you have an obligation to do what's best for them. And we have to figure out the very best way to have people get a chance to express their religion, their affection, and their love in the safest way possible. And so I would just say to every leader who has followers, recognize that you're not putting yourself at risk, you're putting others at risk.
Buenas tardes, mi nombre es Ricardo Romero Morales, soy oficial de información pública de aquí del condado de Santa Clara. El día de hoy se anunció que se proyecta que el COVID-19 será la tercera causa principal de muerte para los residentes del condado de Santa Clara. El total de muertes por la pandemia superó los 600 en esta semana, lo que sirve como un recordatorio importante acerca de los peligros de reunirse durante estos días festivos. Estos son 632 muertes, y no solamente es un número, son 632 familias, 632 personas que no estarán celebrando estas fiestas decembrinas. Les estamos pidiendo a la comunidad que por favor les urgimos que cancelen sus viajes, sus planes de viajes. Les pedimos que digan no a las reuniones con gente con la quienes no viven. También les queremos recordar el uso de su tapabocas. Todas estas acciones unidas son niveles para que así la comunidad esté segura. En esta temporada decembrina, el mejor regalo que le podemos hacer a nuestros seres queridos es regalarles salud, para que así podamos celebrar con ellos en los años por venir. Estuvimos aquí antes del Día de Acción de Gracias para urgirles que también cancelaran sus planes de viaje, que cancelaran sus reuniones. Estábamos anticipando una ola de casos, la cual pasó. Como ustedes pueden ver en las gráficas, el número de casos ha aumentado dramáticamente. También hemos estado viendo que los números de hospitalizaciones han estado aumentando, al igual que el número de muertos. Una vez más de 600 muertes llevamos ya aquí en el condado de Santa Clara. Ahora estamos aquí el día de hoy para pedirles lo mismo, que cancelen sus viajes, que no se reúnan con gente con la quienes no viven. Ya estamos sobre una ola sobre otra ola es algo dramáticamente peligroso, en lo cual nos llevaría al borde de no tener ninguna cama, no solamente en el área de cuidado intensivo, pero en todos los hospitales. Hasta el día de ayer solamente teníamos 33 camas de cuidado intensivo en todo el condado. Ayer tuvimos 68 pacientes en la sala de emergencias esperando por una cama para poder ser atendidos. Les estamos urgiendo una vez más a la comunidad que por favor lo hagan por sus seres queridos, lo hagan por su tía, por su mamá, por sus primos, por sus hermanos. Sabemos que la fatiga de esta pandemia es algo real. Sabemos que ya todos estamos cansados. También el personal que trabaja en los hospitales ya está cansado. Pero seguimos aquí, luchando para salvar más vidas. Y no solamente es una fatiga física, pero también es una fatiga emocional. Una fatiga la cual de ver cuántas personas están muriendo. Y son muertes las cuales se pueden prevenir. Son muertes que si ponemos nuestra parte, nuestro granito de arena, podemos prevenir y podemos tener una persona más en nuestra familia el próximo año para celebrar. Una vez más, el mejor regalo para estas fiestas es el regalo de la salud. El regalo de poder tener a nuestros padres, a nuestras hermanas, a nuestros hermanos, primos, familia, amigos, y poder celebrar con ellos los años que vienen. Por favor, cancelen sus viajes, digan no a las reuniones, sigan usando su tapabocas. Recordemos que todo esto son esfuerzos que no solamente con usar el tapabocas vamos a solucionar todo. Son diferentes niveles que juntos nos van a ayudar a luchar contra el COVID-19. Gracias.
Xin chào quý vị, tôi là Khánh Ly, là nhân viên truyền thông của quận hạt Santa Clara. Ngày hôm nay quận hạt Santa Clara đã tổ chức một buổi họp báo để đưa đến cho quý vị những thông tin vừa được cập nhật trong quận hạt. Kính thưa quý vị, COVID-19 đứng thứ 3 trong số các nguyên nhân gây tử vong hàng đầu tại hạt Santa Clara. Số người chết vì dịch bệnh COVID-19 chỉ đứng sau bệnh tim và bệnh ung thư. Các viên chức Sở Y tế đã thống kê và thật đáng buồn là số trường hợp tử vong trong quận hạt của chúng ta đã vượt quá cột mốc quan trọng là 600 người. Tính tới thời điểm hiện tại thì đã có tổng cộng 60.000 ca trường hợp nhiễm bệnh COVID-19 và có 632 người phải mất mạng vì con virus này. Chủ tịch Hội đồng Giám sát và Cindy Chavez đã nói rằng chúng ta thực sự rất buồn vì gia đình của những người đã khuất này sẽ rất đau buồn trong mùa lễ năm nay. Quý vị cũng đừng quên là vẫn còn rất nhiều bệnh nhân đang phải nằm viện trong quận hạt và các nhân viên y tế đang cố gắng từng giây từng phút để giúp cho những bệnh nhân này vượt qua giai đoạn khó khăn, vượt qua giai đoạn nguy hiểm. Bữa cơm gia đình tưởng chừng như là đơn giản bởi vì chúng ta gặp nhau, cùng nhau vui, cùng nhau ăn bữa cơm gia đình, nhưng đó lại là cái nguy cơ rủi ro cao nhất lây lan bệnh COVID-19. Hãy bảo vệ những người quý vị yêu thương bằng cách ở nhà, hãy đừng ghé thăm một nhà khác hoặc là đừng ghé thăm một người nào không sống chung nhà của quý vị. Chúng ta sẽ còn có cơ hội gặp nhau trong tương lai, thành ra là hãy bảo vệ tất cả những người mà quý vị thân yêu và bảo vệ cho chính sức khỏe của quý vị để chúng ta còn có thể gặp nhau trong tương lai. Vào giữa tháng 11 là một tuần lễ trước ngày lễ tạ ơn thì trung bình mỗi ngày có 3 người tử vong vì Covid-19. Một tháng sau thì cái mức trung bình đó đã tăng lên là 6 người tử vong mỗi ngày. Tỷ lệ trường hợp nhiễm bệnh trung bình trong vòng 7 ngày của quận hạt đến ngày 13 tháng 12 là 7,7%, là cao nhất kể từ khi đại dịch bắt đầu, là tính từ tháng 3. Nếu như mà chúng ta so sánh cái con số này với những cái tháng trước đó, thì vào ngày 19 tháng 11 là một tuần trước ngày lễ tạ ơn thì tỷ lệ trung bình 7 ngày của số người nhiễm bệnh là 3,4%, và vào ngày 27 tháng 5 là tỷ lệ trung bình 7 ngày của số ca nhiễm là 1,3%. Nếu như mà chúng ta nhìn vào những con số đó thì những con số này là không có nói dối được, thì chúng ta sẽ thấy là các trường hợp nhiễm bệnh tăng cao bởi vì chúng ta đã tụ tập trong dịp lễ, là trong dịp lễ tạ ơn, thành ra là cái số người nhiễm bệnh càng ngày càng cao hơn và dẫn đến việc là chúng ta không thể nào kiểm soát được nữa. Giáng sinh và năm mới đang đến gần thì các viên chức của quận hạt đang nhắc nhở tất cả các cư dân hãy thực hiện phần của mình là hãy đeo khẩu trang và tránh tụ tập với những người không sống cùng nhà với mình. Quý vị ơi, nếu như mỗi người chúng ta cùng nhau thực hiện cái phần của mình thôi, là hãy bảo vệ cho sức khỏe của chính mình, thì chúng ta đã đóng góp rất là to lớn trong cái việc mà đẩy lùi cái dịch bệnh này rồi. Thành ra là chúng tôi cũng mong là quý vị hãy cùng với chúng tôi cùng thực hiện, chỉ cần thực hiện cái trách nhiệm của mình là bảo vệ cho sức khỏe của bản thân mình thôi, thì chúng ta sẽ cùng nhau vượt qua cái giai đoạn khó khăn này. Mọi người hãy nên ở nhà nhiều nhất có thể, tránh những cái hoạt động không cần thiết và không nên đi chơi xa, không nên đi du lịch vào thời điểm này. Nếu như mà quý vị bắt buộc phải đi ra ngoài khỏi quận hạt cho những cái hoạt động thiết yếu, ra ngoài khỏi quận hạt trong vòng 150 dặm ra khỏi quận hạt, thì quý vị hãy thực hiện theo những cái chỉ thị cách ly và cô lập được đưa ra bởi quận hạt Santa Clara. Thì những cái hướng dẫn về cô lập và cách ly và quý vị nên xét nghiệm vào ngày nào, như thế nào thì chúng tôi đã đưa tất cả những cái thông tin này lên trên trang mạng của quận hạt rồi. Thì quý vị hãy vào trang mạng của chúng tôi là www.scc.gov.org/cv19-Việt. Chúng tôi đã đưa ra tất cả những cái thông tin bằng tiếng Việt rất là dễ hiểu và rất là dễ sử dụng để cho quý vị có thể cập nhật được thông tin mới nhất. Thành ra là quý vị hãy vào trang web này, và nếu như mà quý vị muốn biết được những con số nhiễm bệnh COVID-19 cũng như là những con số về tử vong thì quý vị cũng hãy vào trang web này. Chúng tôi sẽ cập nhật thông tin hàng ngày để quý vị có thể biết được cái tình hình COVID-19 trong quận hạt. Xin chân thành cảm ơn và xin mến chúc quý vị có một mùa lễ thật an toàn và vui vẻ. Xin cảm ơn.
大家好，我是圣塔克拉拉县紧急行动中心的公共信息官 Ann。今天的记者会主要的目的是呼吁社区的民众在圣诞假期时保护自身和家人朋友的安全健康。新冠肺炎在2020年已经成为圣塔克拉拉县第3大的死亡原因，仅次于癌症和心脏病。这个星期有非常沉重的消息。在圣县因新冠肺炎死亡的人数，在这周已经超过了600人。对于这600多个家庭而言， 这个节日假期是悲伤的。一顿家庭的聚餐看起来可能无害，但是病毒的传播是远超过我们的想象的。在感恩节的前一周，平均每天因新冠肺炎死亡的人数是3个人。1个月之后，平均每天死亡人数倍增，到达6个人之多。确诊的人数也一样，开始快速的增加。从这些数字我们看到，感恩节假期家人朋友的聚会已经加速了病毒的传播，而我们必须减缓传播的速度，避免医疗系统的崩溃，而我们现在已经在临界点上了。随着圣诞节和新年的来临，圣县卫生官员呼吁社区的所有人居家避疫，保护好自己就是对疫情最大的贡献。请大家继续防疫，勤洗手、戴口罩，保持社交距离，取消假期出游的计划，取消和不同住在一起的家人朋友的相聚。更多信息请上圣县 COVID 网站 www.scccgov.org/COVID-19， 可选择中文的页面。祝大家有个安全健康的圣诞节假期，谢谢。